All right, we're back for another edition of Not TMI, where it's never too much information. And this is actually coming from I don't know, it's the experience I probably have weekly. In the health education courses, we have one on STDs, sexually transmitted diseases, and STIs, sexually transmitted infections. And a common question I get at the end is, why didn't I talk about yeast infections, UTIs, and BV, bacterial vaginosis? And I think the confusion is that this is all happening geographically in the same area, and it is an infection, but they're not, in fact, STIs.
So what I like to bring up when we talk about yeast and bacterial vaginosis really is it's more of a pH issue.
Okay.
The vagina is not a sterile organ. There are small amounts of yeast and bacteria that live there.
Sure.
And when one of them outgrows the other, the bad bacteria outgrow the yeast, then you're going to have bacterial vaginosis symptoms, which is going to be discharge, odor, even sometimes irritation, itching, burning. When the yeast overgrow, then you're going to have symptoms of a yeast infection, so discharge, itching, irritation. And this can be more likely after having intercourse because it can shift the pH of the vagina. A lot of times it's also just due to vulvar and vaginal hygiene, where I recommend always wearing underwear that is very breathable. So cotton, there's like a lot of bamboo fabrics out now that are breathable, maybe even sleeping in loose boxers. Air helps with the pH balance. Throwing away all of the washes that say they're pH balanced, because those are actually all lying to you and stealing your money. I recommend Dove sensitive bar soap externally on a wash rag. That's less likely to throw off your pH.
So my vulva is not supposed to be rose scented?
No, no scents, no fragrances. I even have people who become, when they're in their later 20s, 30s, more sensitive, where they used to be able to use this fragrance shampoo that runs down your body in the shower, and now it's breaking them out and causing a pH shift that they didn't have before. So that's really unfortunate when that can happen. Using all free and clear detergents in your wash, things like that. Now, there was a study that came out recently about recurrent bacterial vaginosis and treating the partner. But in retrospect, that kind of seems to make sense, right?
Because why are we not already doing
when
that?
you have intercourse, it can introduce bacteria into the vagina that wasn't there before, or cause an overgrowth of the bad bacteria. And so what they did is they randomized people to just the female was treated for 7 days, as we do right now. And then the other couples were, the female partner was treated, and then the male partner was treated also with an oral antibiotic and a topical antibiotic. And they stopped the study early because it was so obviously superior to the female-only treatment.
That's the kind of study results I need to see, where it's just like, oh, this is obvious. We've got the information we need.
Yeah. But so it's not that straightforward where someone comes in, I diagnose them with bacterial vaginosis, and then it's like, oh no, like your partner is cheating on you. Or it's, the same thing as chlamydia. It's very different from that. But certainly intercourse can cause it to be brought on, make it more recurrent, things like that for bacterial vaginosis. Yeast isn't really necessarily going to be passed back and forth. At least we haven't done that study yet. So.
And what about UTIs?
So I think we did touch on this in a previous episode, but
is it important to pee after sex?
But basically, the female urethra is shorter than the male urethra, so there's less of a distance. Bacteria will need to go. So certainly, having a history of infections is going to increase your chances of getting future infections, because a prior infection can cause scar tissue in the urethra, the opening from the bladder to the outside. Mm-hmm. Even though some people will have recurrent urinary tract infections after intercourse, the intercourse in and of itself is
not the cause
necessarily causing the urinary tract infection, but it can make it more likely.
So if you're having these symptoms, it's important to reach out to your provider so that we can figure out, is this a yeast infection and BV, or do we have chlamydia?